Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
combination therapy of DMARDs. In combination therapy, we can add drugs to the methotrexate. Methotrexate is given. Along with that, we can add some more drugs has combination therapy for DMARDs. So for methotrexate, we can add cyclosporin, chloroquine or hydroxychloroquine or leflunomide, infliximab, adalimumab, rituximab, and etanercept can be added as a combination therapy. So with methotrexate, cyclosporin, chloroquine, hydroxychloroquine, leflunomide, infliximab, and adalimumab, rituximab, and etanercept can be added. When you add, there is no added benefit is seen when you add azathioprine or auranofin or sulfasalazine. There is no additional benefit is seen on adding these agents.
thank you and thank you for watching.